Well, hello. Welcome to Ask a Doc podcast. My name is Dr. Jorge Sanchez. I am your host for today. And to this podcast was inspired by coronavirus. Coronavirus has been a pandemic during 2019 and 2020 that has resulted in a lot of information out there that, frankly, were just not correct. And there was just a need to find a source of information that was reliable. And so I'm a family medicine doctor, board certified, and I am a doctor who's currently seeing patients, and I really want to answer your questions, the things that you want to know, the things that maybe you're not comfortable asking in person. And so be sure to download the Medici app. That's Medici. This is not a show where you can call in to ask questions. You can submit questions through the Medici app. And once you have that downloaded, the Medici app, then you can search me by my last name, Dr. Sanchez, Sanchez, and just submit questions and if anything you need answering for, right? So I would be maybe a little bit criticized if I didn't take a moment to address one of the most critical things, most critical items, most critical news of the day. And that I really don't want to talk about politics. I don't like politics. It's sadly something that I do pay attention to. But I will address the news of the day, and that today is October 2nd, 2020. And this morning, we received the news that Donald Trump, our president, had contracted COVID. And so, it's good that he has adequate health care. For sure, he has some of the best doctors in the country. It's a bit concerning. It's scary, to be honest with you. And I've seen people with his risk factors at the age of 40 actually dying from coronavirus. So it's really, really scary. And I don't like the guy. At least most people will say that, they don't like his tweets. Most people seem to agree with that. But we really need to be praying for this president. We really do not need him to get worse. I would love it if it was just a mild illness for him, although it's not been mild for many. I would say for the 200,000 people who have passed away, it was not mild. But I really, really, really hope that it's mild for him, just for the sake of his country, and I mean, obviously for the sake of him. But we just don't need that right now. I highly encourage people to wear masks. We all need to be wearing masks. Absolutely. I think masks are some of the most effective ways to prevent the spread and the contraction of coronavirus. And during this, it's a small price to pay to wear a mask. The slight inconvenience, it's very, very mild, this inconvenience of wearing a mask. And so I hope that maybe through this podcast I could maybe make a small change, maybe help somebody out there to be able to just get better. And so I want to thank you, everybody who's listening. I have been so blown away by the support that I have received. The number of people has increased steadily, and so I've had about over 500 downloads from this podcast. So I'm super excited that you guys are listening and maybe taking what my thoughts are and running with it. And it's just amazing. And so please share this podcast with as many people as you feel would benefit, and to be able to hear just a trusted resource discuss on topics that you care about and that really affect people quite a bit. And one of the things that has been my most popular podcast has been about weight loss, and which I actually really enjoy talking about. I mean, I can talk forever about it. You can only have so many episodes on the same thing. I guess I could keep talking forever about it. I would be impressed if people were able to continuously listen to me over the same topic over and over again. But if you are someone who's really interested about eating for weight loss, be sure to look at the COVID diets. It was one of the first episodes that I've had, and also I might throw another one out there. I've done topics like how much protein do I need. I've done topics about how to prevent colorectal cancer, which are some of the things that I really do care about talking about. But today we're going to focus on one of the other crises. Is that how you say it? Crises. The other crisis that is occurring in this country, on top of the pandemic, is going to be the chronic back pain. The chronic back pain pandemic. Sorry, it's not a pandemic. The chronic back pain crisis. And so we have, for the past, I would say, around 10 years, so slowly, progressively, in this country, developed a reliance upon narcotics. And it was about, I guess it was 4 or 5 years ago when the rate of death from narcotics was actually started surpassing that of motor vehicle related accident deaths, which was significant to see that the rise of deaths from overdosing from narcotics rising from that. And I want to be able to provide my perspective and also some medical knowledge for chronic back pain. And what is back pain? What's causing it? What are some of the things we can do to prevent the development of chronic back pain? And really the backstory behind what I think is what's going on in this country that is, admittedly, very, very difficult to know what the root cause is. And so I think that I try to have a very sympathetic approach, an understanding approach, and not necessarily blame individuals for the situation that occurs. I think too easily it's easy to imagine that it's only those who are addicted that are abusing medications that are dying from these things, but from taking narcotics and then dying from it. I have personally not had any patients die from narcotic use. It seems to be a lot of the Midwest area, my approach is to have a belief of, I guess, just like sympathy, that people who die from these things, I can only imagine that they're having chronic back pain and they're having this continual situation, and they're just like desperate, and so they just take one extra, and then the following day doesn't help, and so they take one extra, and then that doesn't help, and so in the following day they take one extra on top of the dosing they've had, and so they have a spike of pain and it's just not getting better, so they take one extra, and sometimes it's really a confidence from taking narcotics for 10, 20 years and having this idea that well, I know what I'm doing, and then just having really a lapse of judgment and then not waking up and dying from respiratory suppression. And so I equate it to like car accidents where people just make mistakes. They get too confident. They're not safe. They just make poor decisions, and then they just they die in a car accident, and it's awful. But we can get better in this. And so let me talk about what causes at least the medical research as to what causes back pain, and then I'll go ahead and talk about my I guess as a system, looking at things as a societal system and how it has contributed to the current crisis of back pain. And so there's really two different types of back pain. There is the acute back pain, which happens a lot for those who are 30s, 40s, and 50s, and where you might be I was wrestling with my kid one day and then I got back pain, and maybe something simple, maybe I was just walking one day and had a twinge, and then I just and then I went to go, I was just didn't pay any attention to it, and then I went to go pick up just a little pencil, and then bam, I got hit with back pain. It just kind of says, oh wow, maybe I'm not young anymore. Maybe I'm just old. So that's the typical back pain of the 30s, 40s, and 50-year-olds. And that back pain, typically it's just a muscle spasm that is due to poor posture. And also it is due to, what's the word? The not debilitating, but not being active. There's a word out there I forgot, but basically like muscle wasting and not being active, not being physically fit, not being flexible, not doing your stretches, and not like developed and losing muscle mass, along with poor posture, combined with maybe sitting all day or standing all day. Those types of behaviors will eventually result in back strain. And so a lot of the core muscles, when they if you look at like the muscles of the back, because that's really what's causing it, like much of the back pain is due to muscle spasms of the lower back. And you can tell it's a muscle spasm because it'll grab you. You're like, oh, and then all of a sudden you go, oh, ow, there. And it really squeezes and grabs you. It might burn just a little bit. And so that's going to be muscle strain, not a tear, because generally muscle tears, like I've seen muscle tears of bicep tendons and muscles and quadricep tears. There's like bruising. I mean, there's like, it's bruising. It just looks really bad. Whereas most people, when they get acute back pain, it's not like that. And so it's generally going to be muscle strain with a progression of basically not exercising enough. And the thing is so I'll go ahead and kind of get distracted some. Let's go down the route of like, what is exercise to have a healthy back for those who are 30, 40, and 50-year-olds. And so a healthy back, and if you're somebody who's prone to it, who gets recurrent back pain, it's not simply just walking, and it's not just going for a stroll, and it's not necessarily it's not also going to the gym and just doing exercise either without any tailored specific exercise. It's also what is adequate exercise is really flexibility. That's number one for guys, right? So guys specifically are really bad about being flexible, and I would admit that myself, I'm very bad about being flexible. And so work like every other day doing the stretches that are required to help maintain lower back health. So particularly like the hamstrings. The hamstrings are on the backside, are connected, kind of deep in the buttock area, lower buttock area, to what's called the ischial tuberosity. And when there isn't flexibility, and those muscles will start to contract or get shorter and start pulling on the ischial tuberosity, which is kind of where you sit. And when you do that tilts the pelvis backwards. And it really does get things out of alignment, as a lot of the chiropractors will say. But the original problem is in the lack of flexibility of the hamstring muscles. And so having very flexible hamstrings and doing those stretches maybe every other day, if not every day, are really critical in maintaining a healthy back. And so if I would focus on that. And then also doing stretches that are very similar to yoga. In fact, a lot of the positions are indeed yoga. So now I always get it confused, which dog is it? Because there's upward dog and downward dog. I think it's the upward dog where you're like laying on your stomach and you let your pelvis kind of stay there on the ground, and then you push up with your arms and you kind of bend your back kind of backwards. And so that is, I think it's called the upward dog. That is a very, very good way to maintain flexibility of the back, because you want to have that, it's called lordosis of the lumbar back. So having that curve of the lumbar back is very, very critical. And you can actually help with that by doing yoga exercises in that regard. And so when you have bad posture and then your back starts hurting, it really squeezes things. And in fact, you'll see that on X-ray, that you'll see the spine like straight up and down, which is really bad. It just makes the posture even worse, which is why things progress and why things really kind of take a long time to get better. And so, now for those who are like really in pain right now, so like, man, I'm having back pain right now. Like, can you hurry up and get to the good stuff? So like what you do not want to do for acute back pain is that you do not want to take it easy to the point of laying in bed, even though that it feels better. I know it feels better. I know that you're worried about causing permanent damage by like moving any way. I know that's what you're worried about. But the problem is that you're actually progressing. You're actually causing the pain to get worse, because when you're having these back spasms, the muscle becomes cooler, and like, so when you exercise, you kind of raise your body temperature some. And you know that, right? When you go for a jog, you just get sweaty and you start warming up, which is actually a helpful process for the muscles. As you warm the muscle up through exercise, it allows for flexibility to occur, or at least the amount of flexibility increases. But as you are in an air-conditioned room and you're kind of like laying there, it cools the muscle down and becomes even more contracted, which causes more spasms. And so what would have been 2 or 3 days of pain progressed into about 2 weeks of pain. And so what I do when I have pain like that, I straight up just like grit my teeth, and I'm like, okay, I'm going to do some kind of stretch, because I know what I like to do is I just lay on my back and I let my knees kind of, I lift up my knees, not to my chest, but I just kind of, I don't know how to describe it, but just like it's kind of like creating a triangle with your legs. You just lift your knees up, and allow my knees kind of just to drift to the right and then to the left, and causing my back to twist just a little bit when I'm having really bad back pain. And so that's one thing you can do. Just if it's just like you can't do anything, then at least do that. You're laying in bed, even though I recommend not being in there, and then you allow your knees to kind of drift back and forth. And so, but for those who really want to prevent back pain, I really recommend yoga. I mean, yoga is fantastic, and to maintain a good posture, to really prevent back pain. And I can tell that when I don't do yoga for very long, like my body kind of reminds me, and it says, no, you've been a bad boy. Go do your yoga again. And so I go back to do my yoga, right? So that's gonna but I haven't had back pain in probably about 2 years. But every 2 years, it just seems that it kind of like flares. So I don't have chronic back pain. I just have episodic back pain, which is just because I'm 40 years old and I kind of need to just do some good stretches and exercises. So, and as well as core muscles, right? Strengthening up the abdominal muscles as well, right? Through planks, doing sit-ups, whatever abdominal exercises, but are important. But don't forget to do the stretches as well. I mean, I think those are critically important. And so, anyway, so let me kind of veer off that from there, because that's not where much of the problem with overdosing narcotics occurs. And that's those situations, that's not the case. Where a lot of the problems occur is with the chronic back pain. And so, and that can start around the age of 40. And so it can be 40, 50, 60, or 70, and there's different things that can cause it. And so the thing that I think, well, let me back up a little bit. So if you're having sciatica symptoms, so pain where it's going down your leg, and which is also not necessarily, it may or may not be sciatica, by the way. So just because you have pain tingling that's going on the backside of your leg, doesn't necessarily mean that you have sciatica, because you could just have like very tight hamstrings, because hamstring tightness is they can spasm as well and can mimic sciatica. Sciatica itself is going to be where you have tingling that's a constant tingling, not just episodic sometimes, but a constant tingling. It could be, it's usually on the back of the leg, but it goes from like your lower back to your hamstrings, but it progresses all the way down to the calf and all the way down to your feet. So if it stops at the point of the knee, it's pretty certain that it's likely not sciatica. But if there's a tingling component to it, like a painful tingling, and it progresses all the way down to the leg, all the way down to the toes particularly, then that can be sciatica. And most sciatica will improve within 6 weeks, which is a very long time for most people who are like, man, I'm really hurting. But beyond 6 weeks is when it's like, okay, I think now we need to do something, right? With sciatica, typically the treatment is going to be steroid injections, physical therapy. Very rarely do they do surgery for somebody who has sciatica. That's much more in older patients where their sciatica is chronic and it's due to arthritis. But for young people, it's less likely. Right? You're probably not going to need to have some type of surgery, and I highly discourage people from getting surgery anyway because it really, I think, makes things worse. The only exception is going to be for serious conditions called catecholaminergia. So that's not only tingling going down the leg; it's going to be tingling around the genital areas combined with urinary incontinence, fecal incontinence, like a sudden onset. In older people, I mean, they have a slow onset of incontinence that can be due to age. But for catecholaminergia, which is a serious sciatica, a very serious sciatica, it's actually upper than it's not really hitting the sciatica. It's actually hitting the actual spinal cord, typically a disc that herniates and pushes against the nerve, is causing these nerve symptoms to begin with. But usually with catecholaminergia, it's not just one leg. Typically, it's both legs. It's both legs that are causing severe pain. People tend to be in a wheelchair, although people with severe sciatica end up being in a wheelchair sometimes. But the key distinguishing factor with an emergency, a very true medical emergency with pinched nerves, is going to be basically like, I don't have control of my bowels. I don't have control of my urine. I have numbness in my genital area, and I'm in a wheelchair. I can't walk, and so that is where it is very serious. They'll do a rectal exam to see if you have tone, because a lot of times tone in the anal area, because if you can't squeeze the anal sphincter, that's because you have a very serious, sudden neurological condition that does require emergency surgery. But your routine sciatica, where there isn't fecal incontinence or urinary incontinence, when there isn't any numbness in the genital area, so typical pain, albeit very painful, it is not considered a medical emergency. So that's my thoughts on sciatica. All right, let me move on to the chronic back pain. All right, so now you might have heard of degenerative disc disease. It's like, so the disc itself will degrade over time, and that is actually normal. And the word disease is rather sadly misused in degenerative disc disease. It's like calling age a disease. It's not. I mean, it's just kind of normal. I'm sorry, but you've got degenerative joints, and that's just like, it's like saying I've got wrinkles. I was diagnosed with wrinkle disease. Oh no. I mean, it's fine. I mean, like, you get wrinkles, you get degenerative disc. It just kind of happens. It's okay. And so it's kind of equated to like arthritis. They occur concomitantly, because what you'll see is not only will the disc degenerate, because that happens with just time and age. The discs kind of wear down, they get thinner, and these discs are important for providing good cushion between your actual dorsal columns. Like the bones themselves are important. Kind of like almost it's like springs in your car, like struts and springs. We have these things in our bodies to help absorb shock. And these discs wear down, and then on top of that, you have these osteoarthritis, and so they're the bony part, not the disc, but the bony parts of the spine where they join together, and you'll see, like, in a really skinny person, when they kind of bend forward, you'll see like their spine. So you'll have like the bumps that are on your spine. Some of them are where the bones join together to produce joints, and those can wear down over time. And so the symptoms that occur with osteoarthritis and degenerative disc disease is different than muscle strain, because muscle strain is like the sudden grasping of you, and it's like the sudden stabbing pain, whereas Osteoarthritis usually is going to be where the weather changes and you feel it, right? You feel just stiff in the morning and you just hard to get out of the bed. It takes a few minutes. Or if you overdo it, you just feel very like achy, like a deep ache, more of a stiffness. It's not like a sudden out of the blue, like stabbing pain. It can be severe over time, but it usually is going to be kind of a progressive, slow process. So that's what osteoarthritis and as well as degenerative disc disease. There's not a whole lot you can do to stop the process. Just like wrinkles, you can't do a whole lot to do to stop. Well, I mean, you could with staying out of the sun much. But eventually we all get wrinkles, and eventually we all get degenerative disc disease. So a little bit about like bulging discs. On an X-ray, if you get an X-ray, they'll see discs that are bulging, but it's not so much that the disc is bulging. That's the issue. It's how much is it bulging? Like, is it pushing on the your spinal cord? Is it pushing on your sciatic nerve? Because if it's truly a symptomatic bulge, right? Because you've heard the word before, asymptomatic and symptomatic in the terms of COVID. Like, you can have asymptomatic bulging, meaning that, you just kind of bulges out, but it doesn't push on nerves. So if you're truly having a symptomatic bulge, then it's going to cause like severe sciatica down the leg, right? So that's the issue with bulging discs. Just leave them alone if they're not actually pushing on anything. And a little comment about imaging. It's I would say that it's interesting when people come in to see me. There's this cultural, I guess, like there's this culture of that when you have back pain you need an X-ray, amongst patients. And I was thinking about this. I was like, why do people want X-rays for their back just to make sure? Because it's a cultural thing, because like for sinus stuff, nobody asks me for an X-ray just to make sure that it's like nothing else going on. Like if somebody has sinus infection and they're runny nose and is green and stuff, like I don't ask for I don't need an X-ray because like I'm a doctor. I know what a sinus infection is. And nobody seems to ask me, well, maybe we should get an X-ray just to make sure there's nothing else going on. I'm like, no, there's nothing else going on. I know what it is. I mean, for chronic conditions, sure, right? I can consider like doing an X-ray for chronic stuff, right? So like if somebody has a sinus infection for over 3 months, then I know already that it could be like a polyp, right? So like you can have sinus polyps. But I don't need an X-ray normally if it's less than that. And the same thing with X-rays for the back, right? For the back, could there be anything else going on? Well, typically the story tells everything in terms of whether I need an X-ray or not, right? So like if an elderly person with osteoporosis fell and they fell on their back, I'm going to order an X-ray because the story says that the person probably has like a compression fracture, right? So like, okay, but if you didn't fall and you just had this sudden onset of pain, you're not going to, there's nothing else back there, right? The back there's just nothing else. Well, could it be kidney problems? Well, so like a couple of things. With kidney stones themselves, and I it's hard to explain. And in fact, oftentimes I'm not necessarily sure as to why this is. But with kidney stones, they're more of like, it's called flank, where the pain is on the side. And it's a very severe pain. And it's very characteristic. The symptoms are different. It's more of like it's almost like symptoms of birth, like this colicky pain. You'll have waves of pain and then it'll settle down, and you have waves of pain and then it'll settle down. Whereas in muscle strain, it's a sudden grabbing, sudden shock, and it hits you continuously and stabbing you over and over again. So the pattern is different. And so I try not to get an X-ray as much as possible because I know that there's going to be some confusion and with the X-ray, meaning that we're going to find degenerative disc disease. And that probably is not the cause of the pain for those who are having characteristic muscle strain, right? We talked about the difference between muscle strain and osteoarthritis. Muscle strain is like the sudden pain that's jolting. It grabs you. And if we find degenerative disc disease, it's going to be confusing, and there's a lot of stress around it. And like, oh, what does that mean? Do I need to do anything for that? I'm like, no, that's not the cause of your pain. It was just kind of an incidental finding. It's not the cause of the pain. And so it just leads to like more tests and more studies, referrals to specialists that are just really not necessary. So like, have I ever ordered an x-ray and been like, oh, wow, I was surprised? No. So even for like bone cancer, like I would say like an elderly people who have a history of cancer already, yeah, sure. But that goes along with the idea of the story matters, right? So if an elderly person who already has prostate cancer and then they have this progressive back pain, then yeah, I'm going to order an x-ray because I'm like, well, maybe it's like metastasized prostate cancer to the back. And so we need to find out. But usually there's already like a known history of that. Very rarely do I discover cancer because because I did an x-ray when I shouldn't have, when I didn't order an x-ray and then there was, and so misdiagnosis, right? So usually there's a history of that. There are some exceptions, right? So one exception is there's some fever that, like, I don't know why this person has fever and they're having back pain. I've seen this once where there was an individual who was hospitalized and they were having high fevers, and they end up having it's called osteomyelitis. They end up having bone infection, and so I'm not a big fan of getting X-rays. I really, really am not, and I'm not a big fan of getting MRIs either, because for a couple of different reasons. Because it doesn't necessarily change the course of the. It doesn't necessarily change what we're doing to treat the back pain. So let's just say, for example, if somebody has degenerative joint disease and their pain, say that it's progressed now, right? So now they have osteoarthritis and it's getting bad, and the pain has progressed, but they're not to the point of like, well, it's not that bad. I don't want to get steroid shots. I don't really want to do surgery. It's not to the point of where I'm going to do that. I just want to know, because I just want to know. And then they're like, okay, it looks like you have degenerative joint disease. Okay, well, what do I do for that? We do physical therapy. Well, I was going to do physical therapy I was going to order anyway with or without an MRI, right? So like, it doesn't, getting an MRI for the most part does not change the course of plan. The plan is still to do physical therapy. So I highly discourage people from getting MRIs. The other thing is that it costs a lot of money, and like surprise bills is kind of a big deal, and if I could save people money, because I just don't trust, and also the insurance companies, they really hammer down on us on the MRIs, right? They make us look like the bad people, like they're like, well, the insurance company denied the MRI, but if the doctor calls this it's called the peer-to-peer thing, right? If I call their doctor, it's like, look, I'm a doctor too. Why do I need to call a doctor who's gave up on medicine and who's now working for like the insurance company who doesn't see patients anymore? Like, why do I want to talk to this guy? I mean, that's like a step down in terms of skill level. and I call them and they're like, well, it's not medically necessary, and so they're like, okay, thank you very much for, wasting my time in this phone call, because like, it's just this way of discouraging from it's for cost reasons. But there's some times though that I'm like, I'll go to bat for patients. I'm like, no, look, this guy, I'm worried about chronic equina. This guy, what other reasons do I do it? If the symptoms have been prolonged longer than 6 weeks for sciatica, then they need it. They failed physical therapy. They gave it a good try. But it's just a lot of headache for everybody to go down the MRI route. I would discourage people from getting it. If there's a history of cancer, then sure, let's get some kind of imaging. But in that case, we're not doing we're not doing an MRI at that point. We're really just doing a PET scan. So you can get like a X-ray and then a PET scan. If there is some warning signs, etc., then sure. And so, okay, what else do I have? Oh, there's some other things. Lumbar stenosis, which is severe osteoarthritis. There's also spondylolisthesis, where the spinal columns kind of slip off each other. So that can happen in individuals that are young as well as old, and symptoms are going to be basically similar to sciatica. But I've seen this in persons called spondylolisthesis. Usually, I'll do an X-ray if like there is like a 20-year-old who has chronic back pain for no good reason. So I'm looking for spondylolisthesis. I'm looking for some rare diseases called ankylosing spondylitis. So some rare things. All right. So let me go back to like the kind of systemic big picture look at as far as how we got to this place in this country. Because if you compare the United States to any other country, we are the leader in chronic back pain, and also we are the leader in our consumption of narcotics. And we've been through. That's interesting to say, because there are many countries out there who have been who have suffered war, who have suffered diseases, who are in a really bad place, and yet we are consuming most of the narcotics. And the question is why? How did we get to this place? Is it made up pain? No, I don't believe it's made up pain. Is it over-exaggerated pain? No, I don't believe it's over-exaggerated pain for those who suffer from chronic back pain. So, but what I think has happened, and if you look at, for example, our osteoarthritis, because to me it seems that osteoarthritis is starting to kind of creep into the younger ages, that I really wonder if it's really one and the same crisis as with the obesity crisis. And you look at how osteoarthritis gets developed. It's not simply just wear and tear, although that is the case, such as if you see that in old farmers. In old farmers, their hands have been weathered, and you can see like their joints are larger, and so they have that. And so maybe someday I'll talk about rheumatoid arthritis, completely different. So there is some level of just wear and tear just from repeatedly using your hands. But in sedentary people who are obese, they have a higher rate of osteoarthritis just everywhere. And we found out through research that osteoarthritis not only is a wear and tear or weight-bearing disease, such as like in the knees, but osteoarthritis is actually caused by generalized inflammation, which the most predominant generalized inflammation is going to be through obesity. So just being overweight by itself produces chemicals in our body that cause inflammation. We know that to be the case with cardiovascular disease. Cardiovascular disease or heart blockages is predominantly a inflammatory process. Sure, there's cholesterol plaques, but there's a strong inflammatory process that occurs with blockages of the arteries. What else is there? You'll see like in people in the back of their necks. It's called acanthosis nigricans. So there's like this, like it looks like dirt, but it's not. It's like this dark pigment that's around their neck, and also there are the skin tags, these little tiny skin stuff that grows on their neck, and in the armpits as well. And these are signs of generalized inflammation. Right, so you get inflammation in the skin, you have inflammation in the heart, and it would make sense that there's inflammation of really everywhere, including the joints, right? The joints of the back, the joints of the knees, joints of the hands and shoulders, and obesity has progressed over the years, really starting from the 50s. If you look at old movies, you'll see that nobody was obese. And if you look at like the black and white movies, or even like the movies in the 60s, where it was when you start seeing color come out, you didn't see really people becoming obese until like the 80s, 90s, and the 2000s. And I believe it's because of our national food policy. So the chronic pain is basically a late stage consequence of the decades of obesity that we've had here in this country. And so that's my belief. And in fact, that's a strong belief that I have. And so why do we have obesity in that case? And if you lose weight, will you actually help with chronic pain? And there's a lot of people that are really in a bad place because we rely and have been taught that exercise has been a method to lose weight. Well, what do you do when you have chronic back pain, when you have osteoarthritis? What do you do when you've gone down the route of getting surgery and doing plates and getting your back fused, which I highly discourage people from doing? Is that you become much more sedentary, and then that raises your weight even more. And there's just this vicious cycle that occurs through obesity, and that it's hard to get out of this cycle and circle of just disability. And so you need to throw just more problems onto it, and particularly in rural areas. Rural areas and urban areas, they really have a lot in common, more things in common than you would actually imagine. But the things they have in common, and what I see particularly in the rural areas, is just like food deserts, right? So like these areas of the country where it's just basically Bubba's Barbecue, and then like your corner gas station to eat hot dogs, and that's basically your diet, and you can't find vegetables anywhere. And a lot of places, or the cost of food is very expensive. And so fast food becomes basically your way of surviving. And if you're so poor that you're to the point of eating fast food, it's going to be a really rough ride, because then obesity sets in, and then osteoarthritis sets in, and then disability sets in, and then basically whereas finding a job using manual labor, I mean, it's just impossible, at that point. And so if I could sum it up into how to fix the narcotic crisis or the pain crisis or the obesity crisis, because they're all one and the same. If I could somehow sum it up as to how to fix our societal issues, I will definitely stop blaming people, right? That's number one. Stop blaming people for their medical problems. Yeah, I understand that there's everybody has they make up their decisions, and that they are supposed to be responsible for their actions. I get that, but that's just too simple of statements to make to a very complicated situation. We're humans. We're complicated. We are basically the product of advertisement, culture, of cost, right? So supply, demand, cost, with also the cost of foods. So we are complicated people. That is not necessarily simply that, well, if somebody just kind of wises up and just make good food choices and start doing push-ups, then they wouldn't be in this place. I think that is unloving and not helpful. So if you look at other countries about why they're not in that situation, right? So it's well, it's just their culture. I hear a lot about that. It's just in their culture. There's been, I really think that the culture is the way it is here in the United States, really due to advertisements. If you look at the numerous amount of advertisements for food, for really crap food, like fast food, it is amazing the tremendous amount of advertisements there are. And it has gripped us tremendously. And so if somebody really is desperate to do whatever it takes to lose the weight, to get out of this vicious cycle of chronic pain, and if they're and I'm like, are you really willing to do whatever it takes? Then throw your TV out in the trash. I mean, that is the level of, I guess, that's kind of what has to happen in order to really overcome this, because we know that there is actually legitimate research to show that the number of hours we watch on TV greatly increases the level of obesity, particularly in children. And so throwing the TV away is is like a critical factor. Not turning it on, and partly because not only because of the sedentary behavior it produces, but also because of the advertisements that are bombarding you, all the food advertisements, and we are so susceptible to those, and do not somehow think that somehow you're beyond that and that your judgments are not influenced by advertisements. It is not true. I mean, so like even us as physicians, there's research to demonstrate that most physicians think that we are above somehow like drug advertisements, and as well as the drug sales. Like when we go to, they'll offer us like these nice dinners for free, right? So we can listen to a educational, quote unquote, educational topic on the drug of choice, which happens to be their fancy drugs. And like just every single time, like we like prescribe those medications according to whether like we got a free meal out of it, and the drug companies know this, and they're spitting out like millions of dollars to pay for a physician to basically buy them off. It's a big advertisement that I refuse to be exposed to. And so it's the same thing with people, right? With people, we are bombarded with advertisements, and just turn off your TV. It's not worth it, right? So that's number one. So I think that we've been in our culture, right? Our culture has basically been a product of modern culture in the United States. It's basically a product of commercials, advertisements, etc. Or even shows, right? If you have a show where people sitting around and having a big barbecue, he's like, what are we having for dinner? I think we need some barbecue. So that's number one. The other thing is the cost of food. And that's a big one, and it has to do with the history of the United States and how we do food policy. If I could sum it up somehow shortly, and I'll need to dedicate an entire episode to this most likely. But to briefly summarize is that, so there are subsidies that are put in place, meaning that the government gives out free money to farmers to not necessarily to help out the farmer, right? They really don't care about farmers, man. The government does not. They are interested in manipulating food prices, right? And so they want to, and that was really inspired by World War II, because we needed to feed an army, and the only way to do so was to provide basically subsidies from the governments to farmers to produce these materials to feed the army. Well, that habit kind of continued into the 60s, 70s, 80s, and even to today. The problem with subsidies is that, yes, it produces cheap food, but it's cheap food for some things, not for everything. The cheap food that has been subsidized is not vegetables. It's not broccoli, carrots, lettuce. It's not like cucumbers. It is none of that. In fact, the government classifies those as specialty crops. Ooh, they're specialty crops and unworthy of subsidies. And so those prices will increase dramatically because of the unequal distribution of the subsidies. So where do subsidies go? Where do they go? The subsidies will actually go towards things, guess what? All the raw materials that go into fast food, right? So like it'll go into soy, which is not bad if you just have just the bean itself, but like they process these things tremendously. Corn is not bad for you, but they, with high fructose corn syrup, it is a cheap material, corn is, to where companies can process it, because it costs money for companies to actually process these things. But if the raw material is cheap enough, then they can actually produce high fructose corn syrup, which is awful for you, right? So what else is subsidized? So like meats are subsidized, right? So which is, I mean, meat's still expensive, but the leftover meats, which have been subsidized as well, that goes into like chicken McNuggets, which is like not real meat. I don't know. It's some weird meats. It's really bad stuff that's been subsidized for us. The junk foods, right? The sugars and the carbs that are processed, all of that stuff is awful, 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 awful for us. But if we're too darn poor, then that's what we live off of. And so and also how we go about how we address poverty in the United States, right? So I'm not about giving people everything, but we need to really it needs to be not we need to really fix our perspective as opposed to fighting crime, but rather fighting poverty, right? So in the 1980s and 90s, we had this war on drugs. We really need to have a war on poverty itself, not by criminalizing people, right, but lifting people out of poverty. So, and also if we were able to either eliminate subsidies altogether so that vegetables have a chance, or subsidize them, like every food product gets a level playing field, right? You cannot just have one thing being the main food of choice. You treat all the food products equally, either with or without subsidies. But this partial subsidizing of junk food, it just can't do that. That's awful. And so those are the big picture things, right? It has to do with access to food, the cost of food, the culture that we have that has been influenced greatly by advertisements. And sadly, all this has been basically kind of done behind our backs, or like while we didn't notice that. It's like our weight started to increase. We did not know why, right? So, and we just kept on saying like, well, it's because if people actually paid attention, to their diet, then they wouldn't be this way. But we're not there, right? We're just not there to actually have a full knowledge to make good choices. I think that's how we progressed to the point of having the really bad chronic back pain, to the point where now we're really dying as a consequence of it, right? Because people are overdosing on their narcotics, and how we treat people who are addicted is really sad. We should really look at these addictions not as something to penalize, but really as a mental illness, and to have sympathy and compassion, and to produce rehab programs as opposed to incarcerating people, with those who are on chronic narcotics, and who are in poverty, who have, no other means they can't get a decent job, and sadly, because they're developing chronic back pain, and so they end up, selling drugs that are prescribed. And so it's a really, really sad situation. It doesn't have to be this way. We can make things different. It's just that we have to think differently as a whole society. And anyway, so that's my long talk about chronic back pain. Do your yoga, eat your vegetables, try to consume less red meat, eat more fish, and then just do walking, right? 20 minutes of walking a day. Man, you're going to do awesome if you do that. So that's my kind of medical tip. So if you're still listening, I mean, some people are not listening anymore. They're like, oh man, he went into the food policy and I got lost. So I turned it off. So if you're still listening, then hey, kudos. I am impressed. But hopefully it's at least entertaining if you're like, or you could be like, I totally don't understand what you just said. That happens too. Then re-listen to it. It's fine. All right. Well, hey, y'all have a fantastic day, and send me ideas as to what you want to listen to, what would be helpful. I can still talk about COVID. We can go through that if you want, but just let me know what's of interest to you, and I'll talk to you next time. Bye-bye.